Let's talk about two neck muscles, which are respectively called Splenius capitis and Splenius cervicis. Basically, they are muscles that really go along the vertebrae in your neck, and as you can expect, they will have two main functions. One is head rotation, and the other one is extension of your neck. These muscles refer pain at the top of your skull, on the corner near your eye, and at the base of your neck. In terms of risk factor, I'd like to underline two main issues. One issue regarding neck rotation is to have double screens, especially double wide screens. You see, more or less your visual field is wide like this. So you see, this is the width of 1/69th screen, which is why it was developed to have two A4s next to each other. And now in many offices we have two wide screens next to each other. So this is much wider than your visual field, and people spend much more time in asymmetric or rotated positions, and that will be a source of overload of these muscles. So my advice on this is organize your work as much as you can, so as to have most of your work, say 80% on one screen, which you place in front of you, and the rest on the screen which is to the side, which you put on the side of your dominant eye, so that your eyes move more than your neck does, and you work only 20% on, say, the interior part of this side screen. The second, and in my opinion, really underestimated risk factor is this story of neck extension. Neck extension will come every time you kind of slouch in your upper back whilst looking forward. And that we will have a lot in people who lean on their forearms. Let's imagine that I'm tired of sitting. What will happen is that I will not be deeply supported in my chair and its lumbar support anymore. Little by little I'll end up sliding, and my thoracic spine, i.e. my mid-back, will start collapsing like this, and I will end on my forearms. And you see that my line of sight naturally goes down. I'm looking at this part of my desk now, but my screen isn't there. So to keep watching my screen, I have to do this neck extension. And this is why these muscles will typically suffer from slouch posture, or posture in which you really lean on your forearms. So at causal level, my strong recommendation is that you work on your sitting posture. Of course, I can help you doing that by paying attention to the quality of the support that your pelvis gets, paying attention to the tonus of your mid-back muscle, so that you're not like this, but that you're like this, so that as a result you don't need to put weight on your forearms. You see, my forearms can be completely free. And dimension number 3 is, of course, how long you stay on your chair before you take a break. I mean, there's not one human being who can stay for 2 hours on a chair without having at some point a deviated posture. I mean, the recommendation is everybody should stand up at least every 25, max 30 minutes, i.e. twice an hour. When you know the function of a muscle, stretching is always super easy. The muscle does this, so the stretch goes the other way around. Now, still there are usually some tweaks. In particular, here, I mean, this is the area that I'm going to try to work on. Therefore, I want all the rest to do nothing and to ensure the safety of this region. To maximize the safety of the stretch and the quality of my posture during the stretch, I will sit down. It's much easier to sit well than to stand well. So basically I take a chair, and the stretch will be, well, chin down, let go, and once you're here, you see my elbows are on my knees. I'm having one finger or two fingers on my head, and I'm gently pulling down. But you see, I'm not bending down here or in the upper back. I'm bending down in my upper neck as much as I can, and really trying to keep my chin in between my collarbones. Why only one or two fingers? Because the neck is full of mini muscles, really small muscles. You don't want to pull with your hands. That would be way too much for them. And if you want to stretch one side more than the other, well, the logic is the same. You see, I go there, but still one finger only, and I combine rotation with bending. But still, my elbow is on my knee so that it doesn't exert a crazy strength. By doing that, I make sure that all these muscles are inactive, and the only ones that can pull on my neck are the small forearm muscles. So I'm kind of using small muscles to stretch small muscles. It's some kind of a balance, say. And as always, we keep the stretch for 1 minute.